So, starting with nutritional requirements for lactating mother, there is a link between the mother and child when in terms of nutrition. Okay, so the child for the first 6 months, a month of its life, it is completely dependent on the breast milk. Okay, so that's the importance of how the mother maintains her nutritional status, especially during this particular period of time. Okay, so there is a process associated with the suckling when the infant sucks on the mother's breast, and how milk is getting secreted just because on the child's sucking reflex. Okay, so as soon as a flow chart is given in your textbook on the first page of this chapter on page 171. Okay, a brief explanation of the same flow chart is shown in the slideshow. Okay, so as soon as the child sucks into the nipples of the breast, that sucking stimulation that will stimulate the nipple, and because of that stimulation, hypothalamus, okay, which is situated just above the pituitary gland, okay, inside your brain, the hypothalamus will get activated. Okay, in response, as soon as the hypothalamus gets stimulated, it gets activated, it will send the signal to the pituitary gland. Here you can see on the right side where hypothalamus is situated. Okay, it's situated here, and then the pituitary gland. Okay, it's downwards, a P-shaped gland you can see. Okay, that's the pituitary gland. So once first the hypothalamus will get activated. Okay, it will stimulate the pituitary gland, and pituitary gland has two segments. Anterior pituitary, which is in the front, okay, it's closer to your eyes. Okay, then we have posterior pituitary, which is closer to your ears. Okay, so posterior back side, anterior the front side. Okay, so the posterior pituitary and the anterior pituitary, they stimulate, and they get stimulated, and they will secrete two hormones. Okay, anterior pituitary will secrete prolactin. Okay, and posterior pituitary, that will secrete oxytocin. Right, so with the name itself, let's take the anterior pituitary. Okay, anterior segment of your pituitary gland is going to secrete prolactin, hormone prolactin. Okay, from the name itself, you can make what would be the use of it. As soon as this prolactin gets secreted, it will stimulate the mammary glands, it will stimulate the breast for milk production. But just by producing the milk, that is not enough. Okay, the milk has to be let down through the alveoli when it is getting produced, and through the lactating ducts, the ducts of the mammary gland, it has to reach the nipple, and from the nipple, it has to be propelled out into the infant's mouth. Okay, that is done because of the help of hormone oxytocin. Okay, oxytocin is a very important hormone in terms of childbirth as well as after birth during lactation. Okay, it also helps in the contraction of uterus. Okay, during birth and all, we do have synthetic oxytocin available to induce childbirth. Okay, so this is a process here. Have you understood the process? Should I explain it again? Should I explain again, or did you understood the process here? Yeah, so as soon as the child sucks into the nipple, okay, of the mother's breast soon after the birth, this sucking stimulation, as soon as the mother feels that, okay, the child is sucking onto her nipple, that will stimulate the hypothalamus gland. Okay, hypothalamus gland is positioned here just near the pituitary gland inside your brain. Okay, so hypothalamus will first get stimulated, and because of that stimulation, in response to the hypothalamus getting stimulated, the posterior pituitary and anterior pituitary gland has two segments, posterior pituitary and anterior. Anterior means it is in front, it is close to the eyes. Posterior pituitary, it is closer towards the ear. Okay, so these two segments of the pituitary gland, okay, that they will secrete two different kinds of hormones. The anterior pituitary gland will secrete prolactin. From the name itself, you can understand it is related to milk production. Okay, it will enable the mammary glands to produce milk. But whereas the oxytocin, that will help the mammary glands to propel forward, okay, to push forward this produced milk. Otherwise, if oxytocin is not secreted in enough amount, what happens is there is a disorder called breast engorgement. Okay, it's very common after soon after childbirth, when the mother's breast is filled up with milk. Okay, her breast will become engorged, the vessels as well as the breast becomes tender. It is very painful and it is very uncomfortable for the mother when her breasts are filled with milk and it is not getting propelled out, or the infant is weak in sucking. Okay, so this is what happens here. So two main things which you have to remember here. What is the use of oxytocin? What is the use of prolactin? From which part of the pituitary is oxytocin released? From which part of the pituitary is prolactin released? Okay. And which are the glands which is involved in this particular process? The same process in a very simple explanation. It is given on page number 171 in your dietetics textbook. Please go through that. It is much more easier. Okay, in a flow chart it is given. So hormonal control of lactation, not just prolactin as well as oxytocin, estrogen and progesterone is also involved here. Okay, so during the 9 months of pregnancy, progesterone would not be released by ovary. Okay, instead progesterone will be released by placenta. Okay, only a very few trace amount of progesterone can be secreted by ovary, because progesterone is a hormone which will be secreted in the later phase of your menstrual cycle. Okay, when menstrual cycle is divided into two phases. Actually, it is three phases, but just for the to understand the hormonal perspective, let's divide the menstrual cycle into two phases. Okay, 28 days divided into 14, 14. The first 14 days, estrogen will be secreted, and in the later 14 days, progesterone will be secreted. Okay, so but during pregnancy, in the absence of menstruation, progesterone secretion will go into a very minuscule level. Very trace amount of progesterone will be secreted by ovary. The remainder of the progesterone is secreted by the placenta. Okay, so estrogen, again, ovary will still continue to secrete estrogen, and that stimulates the breast development. Okay, as soon as when the child is born, the breast, as the milk alveoli, and the ducts, etc., are ready to propel out the milk as soon as the child is born, so that it comes under the breast development. Then progesterone prepares the breast for milk production by changing glandular cells and secreting cells. So glandular cell secreting cells that are in depth. Okay, what are the function, how these things get developed, etc., that will be taken in detail if anyone is interested in lactation counseling course. Okay, there is one textbook. NHCA does provides lactation counseling course also. It's a self-study course. Classes are not taken up for that. Some of the students who are present here have already cleared lactation counseling course, those who have enrolled in the previous exam. Okay, so in detail, the anatomy, the physiology of all these hormones, how it works, how anatomically changes to take place during the pregnancy, that is given in detail in that particular textbook. Okay, so if at all you're interested, you can contact me later to know more about this course. Okay, next, prolactin, as told earlier, it is secreted by the anterior pituitary. It stimulates in milk production. From the name itself, you can make out that. And then oxytocin, posterior pituitary, facilitates in the release of or propelling out the milk from the alveoli into the duct and finally through the nipple into the child's mouth. So these are the hormonal aspects of lactation. So any imbalance, if the mother is facing any imbalance in terms of these hormones, it will invariably affect the lactation. Okay, so coming to nutritional requirements, before that, there are a few factors that is affecting the composition and volume of breast milk. There are a few myths also which has to be resolved. Okay, that like in some cultures, lactating mothers are not allowed to have certain food, okay, because of some cultural beliefs. But the only time when mothers should restrain from certain types of food, if it is causing causing any irritation to the child's bowel system or gastrointestinal system, only in that cases mothers can avoid certain food. Otherwise, all the other categories of food can be consumed. Okay, there are no restrictions here. And lactation is a time period when the nutritional requirement is highest. Okay, it is more than what it was in the pregnancy. Because remember, in the first few months, first 6 months of a child's life, when the child, if the child is born, let's say 2.5 kg at birth, the child is born with the weight of 2.5 kg. Okay, within 6 months the child has to reach at least 5 kg or more. Okay, so just depending on just the mother's breast milk, the child has to double its weight up. So that's a big task and big responsibility on which is put on the mother to amp up her nutritional requirement. So the whatever nutrition in terms of each and every micro and macronutrition, it is quite heightened as compared to the nutrition what she was having in pregnancy. Okay, so whatever maternal fat stores, okay, whatever weight gain a mother had undergone during her pregnancy, that fat stores will help in milk production during the lactation phase. Okay, and the milk of a primary gravida, for example, the mothers who are first time mothers, okay, a woman who became a mother for the first time, the fat content in her milk would be much higher as compared to women who had previous births. Okay, so as soon as the gestational number, the gravidum increases, okay, the quality, the fat quality of the milk decreases. Okay, so the fat content for in the mothers who are first time mothers, that is quite high as just in compared to multigravidum. Okay, then the frequency of the milk removal is important. For example, if a mother is frequently feeding her child and the child is able to suck and adequately feed itself, okay, that will automatically increase the secretion of the milk. If frequently a mother is not feeding the child, if proper scheduling of feeding is not done, that will also affect the production of milk. That will reduce the production of milk. And again, if the mother is undernourished, the milk will have less quantity, as well as the quality of the milk will also get affected. And yeah, there are few substances that are independent of the mother's diet and few substances that are completely dependent on mother's diet. Okay, these points are given on page number 172. So lactose, protein, calcium, iron, copper, fluorine. Okay, these things are independent of the mother's diet. Even if the mother is having protein rich diet or calcium rich diet or whatever diet she is having, it is not going to translate into the breast milk. Remember that. Okay, protein, calcium, iron, lactose, copper, fluorine. Okay, these things will not transfer from the mother's diet into the breast milk. Okay, what are the minerals and the vitamins that will transfer? All the B vitamins, iodine, selenium, that kind of micro minerals. These things can be directly transferred from the mother's diet into the breast milk. Okay, so why do we stress upon the fact that, okay, you have understood this point, whatever calcium or protein the mother is going to have, that is not going to be transferred into the breast milk, and that's not how the child is going to get the protein and calcium. So why do you think we stress upon this fact that protein and calcium should be amped up during the lactation? Do you have any guess? Can anyone answer that in the chat box? Protein and calcium, even iron. Okay, it is independent from the mother's diet. It is not going to affect the breast milk. Okay, then why is it necessary? Yes, to keep the mother healthy. Okay, to keep the mother healthy, otherwise the mother's body will get depleted. Okay, the mother's body will get depleted. It is not for the production of milk, or it is not for the content of milk. Okay, remember that the diet which the lactating mother is having, which is rich in protein and calcium, it is not for milk production. Remember that it is not for milk production. Whatever is required for the milk production, that fat source is available in the mother's body during the weight gain which she had, and during the nutritional status which she had kept up during the pregnancy. That nutritional status and that weight gain will help in milk production. Okay, but when we stress upon the fact that the mother should have protein, calcium, and iron rich diet during lactation, it's not for the breast milk, it is for the mother's body. Otherwise, it is very common in Indian mothers. Okay, we will come to this topic at the last. In Indian mothers scenario, usually women who are from the poor socioeconomic background, they deplete their own body reserves. They deplete their own body reserves just to produce good amount and good quality of milk for the child. Okay, that should not happen. To avoid that, to avoid this depletion, is the reason why we stress on protein and calcium and iron rich diet for lactating mother. It is not related to milk production. Okay, the only thing that is related to milk production is B vitamins or the B complex vitamins, some microminerals like iodine and selenium. Okay, that's the only thing that is dependent on mother's diet. Other aspects are is independent of mother's diet with relation to milk production. Then yeah, the lactational capacity of each woman, okay, it depends on her genetic. For example, if a woman's mother or the child's grandmother had a sufficient milk production during her time, okay, automatically it can be understood that the present mother would also have the same genes of the same quality and quantity of lactational capacity. Okay. And if the fluid intake during lactation time is less, automatically the fluid volume of the milk will also be reduced. So these are some points, some important points, which in practical aspect it is quite important. This is given on page number 172. Just go through that. No need to by heart. It is quite understandable. Points are quite easy. It is understandable. So coming to nutritional requirement. Energy. So whatever is the adult and woman's energy requirement, depending on her lifestyle status, like sedentary, moderate, or heavy working woman. Okay, whatever their normal adult woman's energy requirement is. On top of that, there is an additional 600 kilocalories required when she is lactating. If it is a sedentary woman, a sedentary adult woman's daily energy requirement plus 600 kilocalories. Okay, in the first 6 months. And later, after when the weaning is introduced, okay, when the child is getting weaned out of the milk, breast milk, at that time, the calories should be reduced to 500 or 520 kilocalories from 7 months to 1 year of age when the child turns 1. Whatever protein and calcium the mother had acquired during her pregnancy, okay, which had led to breast development, etc., that will be used by the baby. In lactation, while the mother is lactating, whatever nutrients she is going to have, okay, especially protein and calcium, that will go into the protein and calcium stores of her body. Okay, because body will be in a state of depletion when a woman is lactating. So to counteract that depletion, okay, so it's a thing like that. We may say to encourage the lactating mother to have food, we can say, not for you, at least for your child you should have this, but actually scientifically, technically, what is happening is for her own to replenish her depleted stores, she's having protein and calcium. Okay, protein, the adult woman's requirement, an average adult woman's requirement of protein is around 55 gram per day, depending on like 1 gram or at least 1 gram of protein per kg body weight. Okay, so considering the a healthy woman should be around 55, the reference healthy woman which we use in ICMR. Okay, so she is considered to be in a weight range of 55 plus or minus 2 above or below. Okay, that's the average reference weight which we consider in ICMR. So plus that, add up extra 19 grams of protein during lactation. Fat, 20 should be 20 gram at least. Okay, these are the at least. at least requirement. So 20 grams of fat plus 30 grams during lactation. Calcium 1200 mg for adult woman. Okay, what do you think is a calcium range? Who is not pregnant, who is not lactating, healthy adult woman? What do you think? What do you think is the calcium range? It's somewhere between 600 and 800. Okay, nowadays it is 800. Earlier it was in some articles they still show 600, but now the revised version is 800. Okay, so in when she is lactating, it is 1200 mg of calcium per day. Iron 26 mg per day. Vitamin A, the regular consumption of vitamin A can be carried out. On top of that, an extra egg, an extra fish liver oil tablet, or any other vitamin A vegetarian sources, to which can provide an extra additional 350 micrograms of vitamin A is required. So if you want to get 350 additional 350 micrograms of vitamin A in form of retinol, one or two, one and a half, not one will not give you, but at least 1.5 to 2 servings of any yellow orange fruits or vegetables that can provide this quantity of vitamin A. For vegetarians, if it is non-vegetarians, one small serving of liver, one whole egg, okay, that can give the sufficient vitamin A. B vitamins, it is given on page number 177. Okay, thiamine, riboflavin, niacin, folic acid, vitamin B12, etc. You can just read through that. About B vitamins, when we will go to the chapter in nutrition science about water soluble vitamins, at that time we will discuss in detail about each of this different classes of B vitamins. Okay. Vitamin C, 80 mg. Why? Because some sources of vitamin C, especially if it is green leafy vegetables or something like that, it will be from vegetables which will be cooked. Okay, and as you know, when vitamin C is exposed to heat, it loses its capacity. Okay, much of a vitamin C is lost when it is exposed to heat. So to compensate that, at least 80 mg of vitamin C should be consumed daily. So for an adult woman, okay, it is 20 of it is 40 mg. Okay, but when she is lactating, keeping in mind the loss of vitamin C during cooking process, we set a target of at least 80 mg. That includes fruits, vegetables, and green leaves which are been cooked and which are eaten raw. Both these cases are included here. Fluid, the total fluid, not just water. Okay, tea, coffee, beverages. Okay, buttermilk, whatever she is having, milk. Okay, whatever she's having throughout the day, the fluid content of it should be at least 2 to 3 liters per day, at least. Guidelines, yeah, including water, whatever liquid things she is having, including water, milk, etc. Milk, it is difficult to make them have that, but milk, we will come to that. Milk, a lactating mother should have at least 1 liter of milk. Okay, that is quite difficult to maintain. Okay, many women who are lactose intolerant, or if she's lactose intolerant, she can go to the other available sources. But even if she doesn't like the taste of milk, it has to be consumed in some or the other way. Okay, at least 1 liter of milk. Maximum requirement of nutrition is, especially during this lactation period, okay, it is much more than what she was consuming during her pregnant days. So balanced diet has to be kept in mind. To make sure she's having a balanced diet, include all the items from the 5 different food groups. Okay, whole green leaf vegetables, fruits, protein, okay, dairy products, fats, sugar. Okay, all the 5 main food groups should be included in her every meal. Different beverages can be incorporated. Okay, and make sure that because if she's not having adequate amount of water, if fruit juices without adding sugar, buttermilk. Okay, in that way, add different types of beverages on a daily basis so that the fluid volume is maintained for at least 3 liters per day. Yeah, 1 liter of milk every day should be consumed. Increase the quantity of the food. Okay, increase the quantity doesn't mean that high calorie and low in nutrient dense. Okay, high calorie diet can be should be given to lactating women, but keep in mind it should be nutrient dense also. Okay, for example, donuts, pizzas, etc. Okay, these are high calorie food category, but their nutrient value, okay, they are very low in nutrient density. Okay, if the mother is lactose intolerant, whatever alternative sources of milk you have, not the dairy ones, the other milks, almond milk, soy milk, etc., that she can have. Okay, but the quantity should be at least 1 liter. Okay, it will not affect the lactation as I explained earlier. This is this 1 liter of milk every day is not for milk production. It is not for affecting the lactation. It is to prevent depletion of the mother's resources. Okay. Then variety should be included, or monotonous diet should not be given. Supplements can be taken. Okay, if you think the mother's diet, because of her lifestyle or because of her socioeconomic status, it is not sufficiently meeting the nutrient requirements, in that case supplements can be given, which are pregnancy and lactation safe. Okay. Special care for teenage mothers and multiple pregnancies, like twins, triplets, quadruplets, etc. And teenage mothers, obviously, because teenagers, they themselves are under the state of development, and on top of that, when they get into teenage pregnancies, okay, it is considered as a high risk pregnancy. Teenage pregnancies are also considered under high risk pregnancies. So we have lactagogues and galactagogues. So what is happening? What does these things mean? Anything that can make sure the mother is producing much more good quality and quantity of milk. Okay, that kind of foods are called galactagogues or galactagogues. So garlic, almonds, methi, fenugreek seeds. Okay, coconut, cascas seeds, poppy seeds, all leafy vegetables. We have this gond which we use in preparation of certain laddus, etc., like methi laddu, or just gond ka laddu, etc., is made. Okay, so it's kind of a gum which is excreted from the acacia tree, sap of the acacia tree. Then we have dill seeds, shepu seeds, sago, sabudana, oats, etc. Okay, these are the food that will make sure they are considered as lactagogues. Okay, some not too much of research is done behind how these things help in lactation, but yeah, some superficial research studies shows that they enhance the lactation capacity in a lactating mother. So in Indian households, I guess methi laddu, okay, even you must know that methi ke laddu, etc., are quite commonly given to pregnant mothers as well as lactating mothers. Okay, so that her lactation capacity improves. And obviously, every culture has their own take on this. Okay, as soon as the mother is lactating, when she starts lactating, every culture has a take on this, that they okay, culturally we are following this thing so that the mother doesn't loses her capacity of lactation, etc. Like fennel seeds, it is not given here. In some cultures, fennel seeds are also considered to improve the lactation capacity. So next, yeah, the food requirements. There are a few points under dietary guidelines, more or less the similar same points I have explained earlier. Okay, that under the dietary guidelines I have explained earlier in the previous slide. Weight management. Yeah, when a woman is breastfeeding, what do you think will be the effect on her weight? Dill seeds, I don't know what you call it in other languages. Please search in Google what are dill seeds called in your respective language. I guess just search for the images if it is visible. You can identify what it is called in your language. Dill leaves are also available. Okay, it has a peculiar taste. Not till, dill. There is a dill leaf. Okay, it is very thin kind of leaf. It looks similar to grass. Okay, it has a very peculiar taste. Not everyone likes it. Okay, please search about this. It's in Google. Cassava in Hindi. Okay, maybe I don't know what it is called. You're getting some examples how it is called in different languages. If you can identify any of it. Yeah, different names for dill leaves are being shared on chat box. Thank you all. Yeah. Coming to weight management, what do you think is the weight aspect during lactation? Is it easily lost or is it easily gained? It is easily lost if the mother is not having good diet, but also there is also the other extreme. Okay, if the mother thinks that if she has a lots of food, she has lots of calorie rich food. Okay, her child, she will gain enough milk so that her child is also healthy and the child also gains more weight. Okay, that will lead to obesity. Okay, so there are two extreme ends. Yeah, it is dependent on diet. There is two extreme end. Okay, if it is a balanced diet, if it is a good diet, whatever excess fat stores she gained during her pregnancy, that should be lost during the especially during the first 6 months of lactation. Okay, without the nutritional depletion for the mother, weight should be lost. And usually it is the lower body weight, not the upper body weight. It's the lower body weight that is easily lost first, and later the upper body weight is lost. Okay. So yeah, about weight management, one main thing you have to remember here, the same point is given in textbook. Obese women should control their calories. Okay, it doesn't mean that if a woman is obese, her calories should be reduced so that she should reduce the weight during lactation. It should not go like that. Calories should not be reduced. Okay, what you can do here is exclude high calorie and low nutrition food items. For example, can you give me any examples like that? Two examples I have shared earlier. Food examples which is high in calorie but very less in nutrition. Yes, white bread. Anything else? Any kind of junk food. True. Donuts. Deep fried foods. Okay. Anything that is deep fried. Yeah, bakery items, whatever is from baked in too much of refined flour and fat. Yeah, carbonated sweet drinks, etc. Yeah. So I guess you understood what is the concept here. If a woman is obese, okay, in the future, if you come across a lactating mother who is obese, obviously her weight is an issue, but it should not be reduced with reducing the calorie. Okay. At least at least let her pass through her lactation with high calorie diet, but nutrient dense food. Okay, you can increase the bulk. Her bulk of the diet can also be increased to maintain the high calorie, but it is giving according to the increased calorie, it is giving good nutrition also. Okay, so low nutrition dense food and high calorie food should be avoided, especially for obese women. Then coming to caffeine, what do you think? should be incorporated here when a woman is lactating regarding tea, coffee, chocolates, etc. What is your take in this? Yes, if we can't say it should be completely avoided. Okay, 2 cups of tea or coffee, whatever is preferred by the woman, she can have it, but not more than 2 cups. Okay, it should be limited. Yeah, it should be limited. Completely excluding caffeine, yeah, and putting the mother other on a emotional stress, etc. Okay, no need to follow that kind of routine here. Limit the consumption of caffeine. That's the correct away here. Okay, just 2 cups of tea or 2 cups of coffee, not more than that. Even chocolates, okay, chocolates also have certain trace amount of caffeine and some other theobromidine kind of actives, and these are known to irritate the child's bowel system. Okay, child's stomach, it will upset the child's stomach because caffeine has the tendency to pass from the mother's diet into the mother's breast milk and to the infant. Okay, so it is caffeine is dependent on the mother's diet. If the mother's breast milk has caffeine means has high amounts of caffeine means she is consuming high amounts of caffeine, it can travel through this. Okay, so caffeine has to be limited. Okay, complete avoidance is not going to help. Any allergenic foods, like if the mother even if the mother is not allergic to such kind of food, but maybe the child may get allergic to this kind of food. Okay, so peanuts, any wheat bran, fish, some kind of fish, cow's milk, eggs, etc. Then we have contaminants. Try to introduce more organic produce in the diet. uh, any agricultural or vegetables or fruits which are like doused in fertilizers, pesticides, etc., that can travel from the mother's diet into the breast milk and it can affect the child. So try to get as much as possible organic food or homegrown food. Okay, then expressed milk. So if especially in when it is a working mother, it's a case of working mother, etc. So when a mother expresses the milk, she uses breast pumps, etc., or just by pressing on the milk and her breast, and she can squeeze out the milk. That can also be done in certain cases. Okay, but using breast pump is the easier, and it's a much easier approach into expressing breast milk. So before expressing the milk, she had to make sure that everything is clean. Hands should be washed, okay, before expressing the milk. And when you are storing expressed milk in the freezer, try not to store more than 100 ml. In textbook, it is given 60 to 120, but to be safe, don't store more than 100 ml in each package, because because as soon as the child is born, the stomach capacity is around few mls, like 5 to 6 ml on the first day, then 10 ml on the second day. By the end of the first week of the birth, it will be around 70 to 80 ml. So it is slowly increasing. The child's stomach capacity is slowly increasing. So do not waste the breast milk by storing too much of breast milk in one single container, because before you give it to the child, you have to slightly heat it. Okay, warm milk has to be given to test the temperature of the milk before you give it. Okay, so these all things has to be done. So it's better to store in small quantities in separate containers than to store the large amount of expressed breast milk in one container, because reheating the same container is not feasible. It will degrade the quality of milk. Okay, exposing the breast milk to high amount of heat on regular basis, that will decrease the quality and quality of the milk in general. So it will not help in child's growth and development. Then we have the concept of human built milk bank. It is increasing day by day. Okay, many of the Indian hospitals are establishing their own area for human milk bank. So the mothers whose child are under NICU, okay, the child preterm babies, etc. Obviously, those mothers will also start producing milk, so that that milk doesn't goes into waste. They can give their milk to the milk bank, and it can be used to feed their own child as well as other children who require milk. Okay, in other cases, when a mother loses the child during childbirth, in case of stillborn or any other complications in which the mother loses her child, she can also volunteer to give her breast milk into human milk bank. So this can be given to children who are preterm, who are admitted in the NICUs, who may have lost their mother during childbirth. Okay, we do see maternal deaths as well as infant deaths during childbirth. Okay, in any of these cases, milk bank comes to help out different victims of such cases. Then exercise, aerobic moderate intensity exercise is suggested, not high intensity. Okay, moderate intensity aerobic exercises is suggested during lactation. Okay, do not go for high intensity exercise or weight bearing exercise, because whatever protein you may consume, okay, that will be used up for building the muscles, etc. Okay, it will not be helped for sustaining the body. So avoid heavy intensity exercise. Do not wear out the mother's body with exercise. Moderate intensity aerobic exercise, examples are given here, that can be followed during lactation. Then lactation failure, when the mother is not able to produce milk, or even if she is able to produce milk, the child is not having sucking reflex yet, or a well developed sucking reflex. So that leads to lactation failure. So many cases may lead to this situation. If the mother is not nourished well, okay, mother is suffering from malnourishment, if she has any acute diseases, any fever, TB, for example, any infectious diseases like TB, etc. Okay, that can also affect with lactation. If the mother is under any kind of stress, anxiety, and in some cases of some severe cases of postpartum depression, okay, postpartum depression can also lead to lactation failure. And engorged breast, swollen breast, which is full of milk, it will be a very uncomfortable situation for the mother. The breast becomes tender. Okay, so it's very uncomfortable. That can also lead to lactation failure. If nipples are sore or nipples are having any wound, etc. Lack of confidence. So if some mother they may have not formed that kind of bond as soon as the child is born. The case is not same for everyone. Okay, in some cases, kangaroo mother care can help, like placing the child as soon as the child is born on the mother's chest. Okay, so that can create such kind of bond, and that can boost the mother's confidence. Okay, then in some cases, if the mother is too busy with her work, or because of her socioeconomic status, she can't rest. If she's a daily wage worker, soon after the birth, within 1 week, she may have to go for her labor work, etc. That can affect the scheduling and the frequent feeding of the children which are born to her. Then infrequent feeding, if you have not, if the mother is not scheduling her feeding on regular intervals of time, that can lead to lactation failure. And when the child is born with like low birth weight baby, premature baby, the child is having issues like cleft lip, cleft palate, okay, that can affect the lactation. Then there are certain medications that will interfere with lactation, directly or indirectly. So if the mother is under any anti-cancer drug treatment, under chemotherapy, etc., that will lead to immunosuppression in the child. Okay, if the mother is having anti-cancer drug, and when the child is having the breast milk from her, the child will go into the state of immunosuppressant. The child will be prone to getting infections very easily because the child's immunity is suppressed. Then if the mother is taking anti-thyroid medication, or if she's taking any iodine-rich medication, radioactive iodine medications, some radioactive iodine medications is used for cancer treatment also. Okay, that can damage the thyroid tissue of the child. Then ergotherapy, it is done, for example, do you think as soon as the child is born, the uterus will stop contracting? What is your take in that? That's the question here. As soon as the child is born, do you think the uterus will stop contracting? No, the uterus will not stop contracting as soon as the child is out of the vaginal canal. Okay, the uterus will continue contracting till the placenta is also out. And on top of that, remember the hormone oxytocin. till the time oxytocin is released, okay, as uh, as long as oxytocin is reduced, even during lactation, that will induce minor level of contraction that will make sure the uterus returns to its pre-pregnant form. Okay, uterus will continue to contract. Okay, within 40 days after labor, within 40 days, um, the uterus has to reach its pre-pregnant size. Okay, and that is done because of the help of oxytocin. And if the mother is not having adequate supply of oxytocin, sometimes she may go for ergot therapy. Okay, ergot therapy is a therapy given to mothers to induce contraction so that the uterus will contract as soon as possible. And when the uterus contracts sooner, okay, it will stop the bleeding as soon as possible, because even after birth, for the next 14 days, slight bleeding will be there. Okay, to prevent that kind of loss of blood, ergot therapy may be started, and it has some side effects in the child's health. Okay, because when the mother is undergoing ergot therapy, when the child is still being breastfed, it will lead to some gastrointestinal issues for the child. Okay, so ergot therapy is done so that the uterus contracts as soon as possible after the childbirth, so that the bleeding can be reduced and the uterus reaches the pre-pregnant state as soon as possible. Okay, within less than 30 days it should reach. Some people may go for that, so it should be avoided until and unless it is indicated. In certain cases, if some mother had uh, too much of bleeding during her childbirth, too much of blood is lost during the childbirth, especially in that cases, ergot therapy has to be continued. Okay, it's a life-saving technique also. Then, if the mother takes oral pills for any hormonal regulation or to prevent contraception or as a contraceptive measures, okay, that will also suppress lactation in general. Okay, because obviously oral pills have hormones, and that will interfere with the normal balance of the hormone which is being secreted in the mother's body. And thiazides, diuretics, if the mother is taking diuretics, that will also suppress lactation. Along with that, nicotine, etc., if the mother is taking doing any substance abuse like smoking, tobacco, chewing, okay, if she's having that kind of habits, that will also suppress the lactation. Laxatives, that will give diarrhea to the child. If mother is taking antibiotics, that will give some gastrointestinal disorders like vomiting, diarrhea, nausea, etc., to the child. These are the effects of different medications. So some medications are obviously contraindicated during lactation. This is the reason why. So Indian nursing mother. In India, um, uh, a huge chunk of the pregnant women as well as the lactating mothers are still undernourished. Okay, they come under the undernourishment category. So if the mother has to take this medication because it is a life-threatening condition, the child will not be breastfed. The child will be put on formula feeding or supplemental feeding. Okay, and some in these cases, the human breast milk bank, that will come into help. Okay, if it is a life-threatening condition for the mother and she has to take the medication, for example, cancer therapy and all, you can't expect the mother to stop the cancer chemotherapy during the lactation, because obviously her life would be in danger. So in that case, the parents, the family can depend on human milk bank. Along with that, formula feeding can be started for the child, and the mother can continue taking that medications. So yeah, in Indian communities, okay, um, in most of the social communities which are socioeconomically backward, okay, their main source of food would be either some cereals, pulses, and one sabji, and their only source of milk would be the milk that is used in tea or coffee. Okay, and coffee is also very rare, rarely used in low socioeconomic background. Usually it is tea. Okay, so rice, dal, okay, hardly one vegetable curry, okay, and then milk from which is used only in tea and coffee, which is obviously not sufficient for the requirement of pregnant mothers and lactating mothers. Okay, this is the usual diet for in a Indian woman's life. Okay, especially who are coming from low socioeconomic backgrounds, etc. So obviously they will be undernourished during their pregnancy. They will be undernourished, and that undernourishment will reflect in their lactation also. So remember that whatever fat stores are available during the pregnancy, those will be utilized during lactation. Okay, so the mother's body automatically goes into the state of depletion. Her fat stores will be depleted. Her calcium stores from the bones will be depleted. Okay, the protein stores from her muscle and her organ proteins will be depleted. Okay, so the mother goes essentially goes into the state of depletion. But what is fascinating here is they had done studies on Indian mothers' breast milk as well as the breast milk of the mothers who are from other countries who are comparatively well fed as compared to these Indian mothers. Okay, but the breast milk quantity remains same. The breast milk quality and quantity of the undernourished Indian mothers, okay, is not inferior to the mothers who are well nourished in other countries. The reason being here is the in Indian mother's case or whichever mother any in anywhere in the world, what happens is anatomically maybe the mother's body is built to deplete herself, to sacrifice her own stores so that the child is at least adequately well nourished. Okay, it is given in your textbook. You can read about that. So comparative studies has been done on the breast milk from undernourished Indian mothers and well-nourished mothers from other countries. There is no difference in the breast milk quality. So, but what is being lost here is the health of the mother. So that will lead to initial early osteoporosis, early osteomalacia. Osteomalacia means softening of bones. Osteoporosis means the bones becomes porous. Okay, so that is the risk factor here. So to counteract this issue, okay, the ICDS program, Integrated Child Development Schemes, etc., and they have started with up with this program of giving Sattu Mavu or health mix for 15 days, every 15 days interval to lactating mothers. 160 gram of Sattu Mavu is given. Okay, and Sattu Mavu is made of this composition. If you do not have access to the government provided Sattu Mavu, which is usually given by Anganwadi centers, okay, you can make it at home. Instead of cashews and badams, if a person is from a low social economic background, they can use groundnut or peanuts here instead of badams and cashews. Okay, and these are the other pulses and legumes and cereals used in Sattu Mavu. Everything should be roasted separately. Okay, roast the green gram separate, then red rice separate, soya beans, cardamoms, corn pulse, roast each of these items separately until they become aromatic, and then it is easier to grind them into a flour. And then you can use this flour into as a mix into the milk, or directly you can mix it into warm water. Okay, add sugar or salt according to your taste, and this porridge can be given to lactating mothers. Okay, so this 160 gram of Sattu Mavu can give around 600 kilocalories of energy and 18 to 20 grams of protein. Okay, on a daily basis, if a mother is having this for at least for 15 days, it ensures that her nutritional stores are not getting depleted. Okay, this the image on the left side is how you can prepare it at home. Okay, using different types of grams, whatever is culturally available, whatever pulses and cereals are culturally available in your region. Okay, for example, pearl millets, etc., maybe not be available everywhere. Corn pearls. Okay, so whatever cereals and pulses you use culturally as a staple in your geographical region, you can include that also. Okay, sago, finger millet, the ragi, green gram, rice, not necessarily red rice. You can use whatever rice is available at your home. Okay, sorghum, etc. Bengal gram. Bengal gram is necessary here. That's a good source of protein along with green gram. Okay, these two are good sources of protein. It should be included. If badam and cashews are not available, peanuts or groundnuts can be used. So this is a package which is given by the government Anganwadis. I guess it is Tamil. It's written in Tamil. So in the state of Tamil Nadu, it is given like this. Okay, government supplied package is given like this. on the left side. And if you want to make it at home, you can follow this recipe.